Okay.
So the purpose of the labs is to determine what type of a thyroid condition the person has. Especially if they have an autoimmune thyroid condition, we need to know in order to treat them properly. And in the medical community, the approach is only to look at one hormone called TSH, thyroid stimulating hormone, also known as thyrotropin. So if a person has hypothyroidism, many times we'll see that TSH is high, and then they just give out the medication. So they're really only looking to see, is there a need for the medication or is there not a need for the medication? But they don't know why the TSH would be high. They just see it and know that it's high, and then they give the medication, and if it's not high, then they don't give the medication. So it's not a very appropriate, in my opinion, it's, I'm just giving my opinion, and this opinion is shared with a number of other people, such as my mentor, Dr. Datis Karazian. In my opinion, that's just not an appropriate way to practice medicine or to treat your patient structurally, chemically, and emotionally in a way that's going to be for in their best interest and help them with their health the most. Interestingly, there's a number of herbs that also can help a thyroid condition or hinder it. What we're going to look at in a minute, not a couple minutes, is that with our autoimmune thyroid patients, they have either what's called a Th1 dominance or Th2 dominance. I know you're just looking at this at home and you're not necessarily a doctor, and maybe you just have a little health concern and you want to kind of find a person who can help you to feel better. And so you may not be interested in all the little gory details. So I'm not going to get into too much detail. So hopefully you're happy with that. But I do want to touch upon some important things, okay? So let's start talking about the labs. It's about time that we do that, okay? Now, if a person has one of these autoimmune thyroid conditions where they're Th1 or Th2 dominant, meaning they have they either have the natural killer T cells that are more predominant, or they have the B cells that are predominant. So we're calling these B lymphocytes or T lymphocytes. One is made mainly in the bone, the B lymphocytes, and the other one is made mainly in the thymus gland, the T lymphocytes. And these are both a type of white blood cell. And these types of white blood cells are active, and so why don't we just say the reason why we're looking at these white blood cells is because we find that these autoimmune thyroid patients have a viral infection. So in order to determine the type of viral infection that they have, we need to do the appropriate lab. And by doing that, we're able to treat them accordingly with the right herbs or nutrients and other therapies. So for instance, with one type of autoimmune response, and I'm really talking mainly just about the autoimmune thyroid condition right now, which I might jump around a little bit, but in one type of autoimmune response, the person will do well with things like licorice root, astragalus, certain herbs, and not do well with other herbs. So things like reishi mushroom, ganoderma mushroom, Coriolis mushroom, green tea extract, these things won't work well for them. Luckily, with both thyroid conditions, people generally do quite well with vitamin D and essential fatty acids like omega-3s. Some of the favorites are DHA and EPA, eicosapentaoic acid. So these are the things that are important when helping these patients. And I really think it's important for healthcare providers to be well educated and consider these things. Interestingly, Dr. Datis Karazian does travel around the country and teach other licensed healthcare providers, including medical doctors, how to treat these particular types of thyroid conditions. That's one of the reasons why I have his book here. So the first lab test that we need to look at would be the one for TSH. TSH, also called thyroid stimulating hormone, comes from the pituitary gland. You know, why don't I just get a new sheet here and then it'll be easier for you to follow what I'm talking about. So first we have the hypothalamus here. That's the hypothalamus. And the hypothalamus releases a hormone called thyroid releasing hormone. TRH, to the pituitary. Can you see this okay? Hopefully you can. Okay, and then the pituitary releases thyroid stimulating hormone. This is going to be another The pituitary releases thyroid stimulating hormone, which tells the thyroid hormone to make more thyroid hormone, which is thyroxine. We're not really talking a lot about calcitonin right now, but anyway, it tells the thyroid gland to make more thyroxine. I'll just repeat that. So when the pituitary releases the thyroid stimulating hormone, this thyroid stimulating hormone, as its name implies, stimulates the thyroid to make more thyroxine. Okay? Thyroxine, then we'll go over how that works right now. Now the thyroxine is going to allow the thyroid to release T4. Remember, 93%, not 97, 93% of all the T4 is made at the level of the thyroid, and then about 7% of the T3 is made at the level of the thyroid. And that's where that comes from. So we got to look at the TSH. Okay, that's what Dr. Datis Karazian recommends in his book. Look at the TSH levels and see what you get. That's one of the important lab values that you need is TSH. Okay, and then he gives the ranges and whatnot in his book, which is great. The other thing we need to look at is what's called, this is a lab finding, okay? We need to look at TT4. We need to look at total T4, okay? There's a lot of reasons for that, and the main reason is that if we don't look at total T4, we can't really get a good understanding of what's happening in the kidneys, because T4 is converted in the kidneys to a great extent, and it just so happens that if you look at the active T4 or free T4, it tells you what's happening in the thyroid gland, and that's nice, but then you don't know what's happening outside of the thyroid gland. And since a thyroid problem is never a thyroid problem, you need to know what's happening outside of the thyroid. You don't really care much about the thyroid most of the time. You want to know, how did the problem get there to begin with? What's the cause of the problem? The highest good is to find the cause, according to Hippocrates. So let's take a look at how that works. So we got total T4 here. We're going to take a look at that, according to Dr. Karazian. The other thing we need to take a look at would be free T3. Okay, so we got three different values we're going to look at so far. Okay, so we're looking at TSH, total T4, and free T3, a free T3 index. That's why they call it FTI, or free thyroxine index. And the next thing, okay, so why is that important?